is Robin Fertel. I've been a psychotherapist here in San Diego for the last 18 years. And I am just needed to make this video because I'm absolutely appalled at the epidemic of our depression, of our kids, our teens committing suicide, our adults. The depression epidemic is just at all-time high. And my question is, what are we going to do about this? Everyone's always talking about mental health. First of all, when you have chemical depression, no matter how much therapy you do, if your neurotransmitters are not working, you are going to need a lot of help, and organic help. And what most people do is they switch from one antidepressant to the other, and then you're left with a bunch of side effects, and it's an experiment. And oftentimes people go into deeper depressions because they feel like the antidepressants aren't working. And so I'm here for call of action. There is a treatment that everybody should know about. It's called transmagnetic stimulation. And no, I'm not a sponsor of it. I get no kickbacks. I'm just telling you. This transmagnetic stimulation is a non-invasive, non-surgery, organic way to reboot the brain. It has been FDA approved since 2008 for two machines called NeuroStar and BrainsWay. And basically what you do is you go in, it's a huge time commitment, but those of you who have suffered from depression will do anything to get out of it, right? So you go under for about 30 minutes, you have a helmet, and you have electric stimulation to your brain. So it actually reboots your prefrontal cortex, and the blood starts flowing into the areas in your brain that are causing you to have depression and your neurotransmitters to not work. It's called transmagnetic stimulation. It is extremely difficult to get your insurance to approve it because they want to know that you've tried other antidepressants, which makes absolutely no sense. It's considered the last line of defense in depression treatment, meaning that the patient has tried many different antidepressants and they haven't worked. So let's do TMS. And in my opinion, and I'm hoping that people lobby their insurance companies, that this should be the absolute first line of treatment before people have to go under experimental psychiatric drugs. The greatest news too is if you're on psychiatric drugs, you get to stay on them as well, or sometimes over time the doctor can lower your amount. But it is an extremely effective treatment. It's FDA approved for anxiety and for depression. So again, you might want to look it up, research it, message me if you have any other questions. This is not intended for medical use advice. I am a psychotherapist, not a doctor, but I have seen this treatment work for thousands of people.